What is silent drowning and how does it happen? Imagine being in water and feeling fine, but hours later, suddenly having trouble breathing or feeling very tired. This is what is called silent drowning, a serious condition that can happen after a water incident. It is also known as dry drowning or secondary drowning. It is important to understand because it can be life-threatening if not recognized and treated quickly. Silent drowning happens when a child gets water into their airway during a near-drowning event. Sometimes, even if they do not swallow a lot of water into their lungs, the water can irritate the airway and cause a reflex called laryngospasm. This is when the vocal cords spasm and close tightly, blocking air from entering the lungs. Because of this, the child can have trouble breathing even though they did not inhale a large amount of water. If water reaches the lungs, it can cause damage to the lung tissue. This damage can lead to inflammation and fluid buildup, which is called pulmonary edema. When fluid builds up in the lungs, it makes it harder for oxygen to pass into the blood. This process can happen gradually over minutes or hours after the water incident. As a result, symptoms may not appear right away, which is why it is called silent drowning. The signs of silent drowning can be subtle at first. A child might cough persistently, complain of chest pain, or seem unusually tired. They might breathe quickly or wheeze, and some children may vomit or become irritable. As the condition worsens, they may show signs of difficulty breathing, confusion, or lethargy. Because these symptoms develop slowly, it is easy to miss the seriousness of the situation at first. Oxygen deprivation from lung injury can affect the brain and other organs. Children may become confused, irritable, or very sleepy. If these signs are noticed, immediate medical attention is essential. Without prompt treatment, silent drowning can become life-threatening. Medical care usually involves giving oxygen, monitoring the child's breathing, and sometimes hospitalization for respiratory support. To prevent silent drowning, constant supervision around water is vital. Never leave children alone near pools, lakes, or bathtubs. Teaching children water safety skills appropriate for their age can also help reduce the risk of drowning. After any water incident, even if the child seems fine, it is crucial to seek medical advice and watch for any symptoms over the next 24 hours. Early detection and treatment can save lives. In summary, silent drowning is a delayed form of respiratory distress caused by water exposure that can be hard to detect early. It can happen to children of any age and requires careful monitoring after a water incident. Recognizing the warning signs and seeking immediate medical care can prevent serious health problems or death. Always remember that water safety, supervision, and quick action are the best ways to protect children from this hidden danger. If you have concerns or questions, consult healthcare professionals for personalized advice.